I know that the doctors ain't supposed to tell you all that, but he says, do you want me to be honest with you? He said that my health plan, in the way it was, that it would only cover about at the most 20% of the cost that it was going to be. Yeah. So it would leave me thousands of dollars to pay.
Well, I didn't go to the doctor for like a year and a half. And finally, recently, I went to a health care thing that they had at my job. Found out my blood sugar was 432. My blood pressure was 155. And I was wondering why. I was feeling kind of blurred vision, feeling kind of weird. And so the woman that did my sugar, she freaked out. And she said, oh my God, do you know what's going on? Do you know what's happening? I said, yes, I'm a diabetic. I said, but I can't afford, to get medication. I can't even afford to go to the doctor.
I go to the VA for my health care, and I was in the military, but I wasn't service connected, and so I have to pay co-payments. I see about 4 different doctors there, and my medication, I have 9 different medications, and I have to pay a co-payment for each one of them, and I think they're $15 a medication every month.
I used to work in construction before. I used to get pretty good money before, but now I'm working as a maintenance guy, and I make half what I used to make before, and I have 3 boys. One has Down syndrome, and he's getting health care, but my other 2 boys, they're not getting none, and I've been going through a lot of problems, and there's no way we can afford health care for my kids, and I'm a single parent. That's one of the things that is not helping me.
I've had my jaw broken too, and because of my insurance, the insurance wouldn't cover for them to be able to adjust my jaw right. I have a bite that is about a ½ an inch off, that I can't chew right, and I suffer with that all the time because I can't afford to have the operation that I need to be able to chew right, and that even affects my my speech too,
And then I got fallen behind. I try to pay every month a payment, but it's not enough, and I got fallen behind. I owe $1,400 right now, $1,400 to $1,600, and it just adds up every month because I have to go to the doctor every month and have to take medications every month, every day. So I still have trouble with my health care, my provider. And because I needed to function, I take a lot of medications. I work full time, and if I didn't have my medications, I wouldn't be able to work. I'm also mentally ill, and that's one of why I have extra doctors, because I have to take mentally ill medicine, and without the medicine, I wouldn't be able to work.
Well, when I had my benefits through my work, it was a very nominal deduction. It was full coverage, it was HMO, it was everything. And I guess the deduction was like $50 perhaps. It wasn't really that much per paycheck. It was a very small amount to cover the whole family. And then when I got laid off, and then I had to pay for the full coverage, and I realized how much that type of coverage cost. It was really humbling to realize that, that's a lot of money.
I know that they need help, but I can't afford it, and she's not gonna do it. I can't. I pay rent. I give her money and my bills and a little bit of food, and that's it.
Made it without the healthy families, we wouldn't have had that coverage. It just wouldn't have happened. I've heard, okay, through the news and lately about the budget crisis for the state of California, that's one of the programs that might be cut. I believe it's a very important program. Maybe if you had told me this a year and a half ago and asked me this question, I probably would have said, or wouldn't have had an opinion about it. It would have made neither and or other. I'm being completely honest here. But being that the program played an important role in my son's health, yeah, I can imagine how many families across the state need the continuation of this program, especially during these difficult times. It has to be a priority. There has to be other things that can be cut rather than cut the health.
Yes, I hope, that we can find a solution. I'm pretty sure we can, where everybody and we can find a health care that would meet anybody's income, and that is my hope, that we can do that, But there's probably more people out there that have diabetes or any other kind of health problem that needs help, and I know, it's our fault we have this health problem, but we need help also, to get back on track, and stuff. So I really do hope we can find something that is affordable.
Please pass the health care reform bill to make it affordable to all people, to even the people that can't afford it. I know a lot of people that they can't afford health care at all. They don't have any health care, and I don't see how they can get by without health care. It's very important that everybody can be able to afford this, to receive health care.
I've been like this for about 4 years now. For approximately around 4 years. I can't tell you exactly, but that's about 4 years. Yeah.
There's, repossessions of homes, foreclosures, and stuff like that. We can always buy another home. We can always rent a house. But healthcare, we're talking about human lives. We're not talking about property. We take so much care of a home, and then it just burns down, or an accident happens, or an act of God, or whatever you want to call it. But healthcare, that's what takes care of our lives. That's a priority. That's a big priority.
But it's too expensive and I can't afford it. And I have years that I haven't went to a doctor. But the main thing right now for me is my kids. So.